Treatment of exhaled ribs require a variety of positions. My school taught us the X dance, which was, if you were to do this dance in public, your partner would leave you and then you would have an X. So the first position was hand over forehead. So 1, then 2, 3, 4, 5, 6, 7, 8, 9, 10. Also remember which muscles are being treated during each position. This is the anterior and middle scalenes, posterior scalene, pec minor, and then the serratus anterior. This comes up on questions quite frequently. For this positioning, you will have the patient bring their hand to their forehead. This is to treat the first rib, which you will then monitor while they inhale and push their head up against their hand and your hand against resistance. Okay? To treat the second rib, the patient will turn away from the side of the dysfunction, and they will again push their head and hand up into your hand and resistance. To treat 3 through 5, monitor the posterior aspects of the ribs. Meanwhile, they will push their elbow towards their feet. Good. And relax. And position it. Each time you're positioning, you will get further superior as they are trying to push towards their feet. For the lower ribs, their arm will be straight and they will push towards their feet as well. Again, monitoring the activation of the muscles around the rib head with your hand under the spine. You're not using it to treat, just using it to monitor to make sure that you are localizing to the correct level for treatment.